Uniqueness of vitamin D. Vitamin D is unique in several ways. 1. Few dietary sources. Unlike other vitamins that can be obtained from a wide variety of foods, very few foods naturally contain vitamin D. The best sources are fatty fish, such as salmon and tuna, and small amounts can be found in egg yolks and some fortified foods like milk and cereal. 2. Sunlight dependent. The body can also produce vitamin D when the skin is exposed to sunlight, which makes it unique among vitamins. When the skin is exposed to UVB radiation from the sun, a form of vitamin D called cholecalciferol is synthesized in the skin. 3. Hormone-like. Vitamin D acts like a hormone in the body and plays a role in regulating calcium and phosphate levels in the blood, which is important for bone health. It also has other functions such as helping to modulate immune function and promoting cell growth and differentiation. 4. Can be stored in the body. Unlike water-soluble vitamins that cannot be stored in the body and need to be consumed regularly, vitamin D is fat-soluble and can be stored in the body's fat tissues. This means that it is possible to have adequate vitamin D levels even if intake is low for a period of time. 5. High prevalence of deficiency. Despite its uniqueness, vitamin D deficiency is common, particularly in people with limited sun exposure or who have darker skin that blocks UVB radiation. This has led to increased interest in the role of supplementation in maintaining optimal vitamin D status. 6. Multiple forms. Vitamin D exists in two main forms, D2, ergocalciferol, and D3, cholecalciferol. Vitamin D2 is produced by plants and fungi, while vitamin D3 is produced by human skin in response to sunlight and can also be obtained from animal sources like fatty fish, egg yolks, and liver. 7. Conversion in the body. Both forms of vitamin D need to be converted in the liver and kidneys to their active form, which is called 1,25-dihydroxyvitamin D or calcitriol. This conversion is necessary for vitamin D to perform its functions in the body. 8. Gender differences. Women tend to have lower levels of vitamin D than men. This is partly due to differences in body composition. Women have higher body fat percentages, which can make it harder for vitamin D to be absorbed and utilized by the body. 9. Age-related changes. As people age, their skin becomes less efficient at producing vitamin D from sunlight, and their kidneys may become less effective at converting vitamin D to its active form. This can lead to a higher risk of vitamin D deficiency in older adults. 10. Geographic differences. The prevalence of vitamin D deficiency varies widely by region, with higher rates found in areas with less sunlight exposure, like northern latitudes. This has led to recommendations for increased vitamin D intake for people living in these areas, particularly during the winter months. 11. Role in immune function. Vitamin D is involved in the regulation of the immune system, and low